watch them bloom for me and you.
Welcome to another edition of Trio Life's Holistic Wellness Center's Healing Through Nature. This is Dr. Spindelilus, and I'm going to go ahead and talk to you today about one of the most common conditions in the U.S. and probably throughout most of Western civilization, and that is Candida. I can't tell you how many times we treat Candida in the clinic. I know of another MD. She wrote an article about a year and a half ago, published in a peer-reviewed medical journal, and even she said that 70% of her new patients that come into the clinic come in with Candida. It is probably one of the most prevalent diseases or disorders currently that we treat even at the clinic. What is Candida? Well, for most people, they know it by the term of leaky gut syndrome. There's some logic to that. We'll kind of go into that here in just a few, but the basic premise is that it is an overgrowth of Candida albicans in your intestinal tract. By our very nature, we are supposed to have approximately 1,400 different strains, different kinds of microflora. Microflora, that's Greek for little plants. So consider your intestinal tract is your garden. And most people, their garden's not doing very good. It's either very much a monocrop or it's a no crop at all, or at least not what we should have. So we have 1,400 different strains in our microflora. And each strain has a different job to do. This strain over here takes care of wheat gluten. This one takes care of soy or corn or this protein or this carb. Many of them also make other things like B vitamins. A lot of people think that, oh, because you're vegan, that you're going to be deficient on B12. What most people don't realize is that we also manufacture B12 in our intestinal tract if we have a healthy intestinal tract. Unfortunately, most people don't. So it doesn't matter whether you're vegan or a meat eater or whatever. If you have a bad intestinal tract, you're probably not going to be doing good on Candida. I mean, we're on B12. It's certainly not Candida. All right, so Candida, you were supposed to have this very large amount of maybe millions of billions of these little intestinal floras. They can be yeast, they can be bacterias. All right, and most of them have their own very specific jobs. Well, one out of them is called Candida albicans. It is a yeast. We are supposed to have it. Some people think we're not supposed to have yeast, but we are supposed to have a very tiny amount. Its job is to break down sugar and alcohol. But in America, we're only supposed to have a little bit of Candida because we're only supposed to have a little bit of sugar, a little bit of alcohol. In America, it's quite the reverse. People have an awful lot of sugar, an awful lot of alcohol, and this tends to help encourage the growth of Candida. Now, even that wouldn't necessarily cause us to have a Candida overgrowth if it weren't for one thing in particular, and that is antibiotics. Now, while antibiotics came about in the early mid-century of last century, when they first came out, the newspapers heralded the discovery of penicillin as a godsend. And many could interpret that way because antibiotics, when they were first discovered, created, were meant for life and death situations. Without them, this patient would have died. That's not the way it is anymore. Back in the 1970s, around 1973, 74, 1 million pounds of antibiotics were made per year. By the 1990s, it was over 10 million pounds of antibiotics. They are now being used for things that they should not even be used for. One, they were being highly overused. They're also being used for viruses and things because a lot of doctors are just taking a shotgun effect, hoping that they'll find whatever or kill whatever is going on. This unfortunately does not work. Antibiotics mean anti-life. They are only for bacteria. They only kill bacteria. They don't kill yeast, molds, funguses, or viruses. So in your intestinal tract, while you have all this bacteria and some yeast, the bacterial component has yet another job to do, and that is to keep Candida in check in its own little ghetto over here. You're supposed to keep it in check, and then you get an antibiotic, and it wipes out not only the harmful bacteria but the beneficial as well. But not the yeast. So one day Candida wakes up and it looks around and it goes, "Oh, I own everything. I own the entire microflora of real estate here." So Candida will overgrow until you get this vast yeast overgrowth in your intestinal tracts, which then produces a condition called dysbiosis. You are supposed to have an awful lot of beneficial bacteria and just a little bit of harmful, so to speak. But when Candida takes over and you've had the antibiotics, you have dysbiosis, which is a whole bunch of the harmful and just a little bit of the beneficial. Okay, now you end up with a series of effects that come about after this. For example, Candida overgrows. Once it takes over the intestinal tract, it begins to crowd itself, and Candida is not very sociable. Okay, I know you know a lot of people like that. Well, Candida can be like that also. When it becomes too crowded, it will literally change its shape, its morphology. It's really interesting in an electron microscope, at least from a doctor's point of view. It looks very interesting. It will change from a yeast, and I'm doing this for a reason, into a mycelial type of fungus. Now, mycelial means it burrows, kind of like mushrooms do. Your intestinal tract is meant to be microscopically permeable, little tiny gaps in it. Because you as a human being, you are supposed to take big particles and turn them into little ones. In your intestinal tract, you're supposed to take foreign proteins. Like if you eat a peanut, when some people eat cows. Okay, well, you're not a cow, you're not a peanut. You cannot use their proteins as they are. So in your intestinal tract, you literally break these down, the proteins, down into their individual amino acids. Those go through the little gaps, goes to your liver, where you reassemble them as U protein. Whatever you are, you're the most unique protein in the universe, just for you, and we'll make it. But when Candida takes over and it goes mycelial, it takes those gaps and makes them very big. Still microscopic, but very big. So now the foreign particles are able to pass through. And once they pass through, they are foreign proteins, other foreign RNA, DNA, and that nature from your food. Your immune system goes, that's not me, that's not self. And all of a sudden you begin to find yourself allergic, hypersensitive to foods you never should have been allergic to. And then of course the autoimmune conditions start occurring and things of that nature. So that's the basic description of Candida. That's why we get the term leaky gut, because parts just literally leak into your intestinal tract, into your bloodstream. And then eventually Candida will leak into your bloodstream. And then it can mimic 100 different diseases. The most common of them all, which incredibly common in this country, is leaky gut syndrome. All right, now it's leaky gut syndrome for chronic fatigue syndrome. All right, and that's where people are tired all the time, and most of the time it is due to Candida overgrowth. All right, what are some of the more common symptoms of Candida? Again, most people in the United States will end up with it at least once in their life. Some of them never ever get rid of it because it is not being treated correctly by most doctors. It's not being recognized enough, even though there are great tests for it, and we will talk about those in a little bit. Some of the most common symptoms: fatigue. Fatigue is obviously the most common of them all, and again, it's one of the most common things in America. Thrush, getting the white coating on your tongue. Most adults don't get it as bad as children do, but the thrush on their tongue is an overgrowth of Candida in their systems, an overgrowth of yeast. But all you got to do is just get a little bit of white on your tongue, and almost guaranteed that will be Candida. It can be some other germ or bacterial overgrowths or infections, but most of the time it will be Candida. Bad breath, very, very common with Candida. Again, it can be a bacterial infection, but again, you see the white tongue, bad breath, you pretty much get a good combination there. All right, other things, very strong symptom are cravings for sweets and alcohol. I have yet to meet an alcoholic that didn't have Candida. Candida, remember that Candida feeds on sugar and alcohol. So while alcohol is a problem and is an addiction, it is made worse because if you have a Candida overgrowth, the Candida itself calls for the alcohol, so to speak. It increases the urge for you to have it. So while it may be hard enough to kick the habit, Candida makes it worse because it basically increases the desire or urge for the alcohol or sugar. Okay, I've seen many people who go through a Candida cleanse. By the time the cleanse is over with, I'm not saying that they're necessarily going to be gone, but their urges for sugar and alcohol often drop dramatically, making it easier to treat them afterwards. All right, other things, loss of sex drive. Unfortunately, very common as well. We see it at the center quite a bit. Loss of sex drive is very common with this because your whole hormonal system is off because of the Candida. Another incredibly common symptom, probably the second most common out of Candida, is brain fog. People just have a problem concentrating, thinking, being able to focus or keep their attention on something. That is incredibly common, one of the most significant complaints we get from patients. And when we hear this list of symptoms, we pretty much know what needs to be done anyway. All right. Joint pain. Joint pain is actually quite common. While there are many, many conditions that can cause joint pain, Candida certainly can aggravate it and make it worse, because the whole attribute, one of them about Candida, is extensive inflammation. Okay, there we go. So, all right. Chronic sinus conditions, bronchial conditions, sinus infections, very, very common with Candida as well. All right, gassy bloatiness, very common in Candida. Think about it. If all this microflora, all the different kinds of bacteria are required to help break down your foods, and they're missing, and about all that's left is some harmful bacteria in Candida, then obviously when that food gets down there, you can figure it out. Put food into a warm, moist place and don't do anything with it. What do you think is going to happen? It's going to rot. It's going to ferment. You're going to get gassy. You're going to get bloated. All right. And one of the most common symptoms, which again is incredibly common, are UTIs, urinary tract infections. Often it is able to be led back to Candida overgrowth. Candida overgrowth goes away. Very often the UTIs, the chronic UTIs, go away. So there's some of the symptoms that we have. What are some of the related issues? Some of the things that Candida appears to cause or aggravate, make worse. Again, one of the very common ones is eczema, or what would often be diagnosed incorrectly is eczema or atopic dermatitis. We look at atopic dermatitis very often as an allergic reaction. But one of the most common things that we see coming from a Candida overgrowth is Candida dermatitis, okay, or vascular Candida vasculitis, where the Candida, the rash, literally starts coming out your skin. It is most common in areas where you sweat or would get hot. Women may very often get it under their breasts, but most others, they can get them under their arms, in between their legs, anywhere where it gets hot and sweaty. And a Candida rash is actually pretty easy to diagnose. All I have to do is ask patients, is it the kind of rash that if you could, you would claw your skin off? And if it gets wet or hot, does it get worse? They usually answer yes. It's pretty easy to tell that that is probably Candida. We can always do a test, but it gets pretty obvious, and it's so common that it's pretty recognizable after a while. All right, other conditions. You can get, again, the rash, yeast infections in the mouth, in the ears. A lot of people describe very itchy ears. That is usually a yeast overgrowth. Yeast infections, generally, both men and women, not just women, get this. Irritable bowel syndrome, very, very upset digestion, like we talked about earlier from the gassy and bloatiness. It will often be diagnosed as irritable bowel syndrome. While that probably is not the best diagnosis in the world, I would rather call that more of a symptom, that very often Candida is the cause itself, which leads us to even more serious issues. I have seen issues such as Crohn's and ulcerative colitis. Now we're talking about inflammatory bowel. Okay, those are often due to autoimmune issues, which Candida has a direct relation to. Remember how things start leaking into your blood and your immune system starts overreacting. Okay, and we've seen cases where get rid of the Candida and start treating the bowels, and even Crohn's and ulcerative colitis can go away. We've seen it happen. All right, what else have we got here? Interstitial cystitis is a very common symptom or condition with Candida. Interstitial cystitis is simply inflammation of the lining of the bladder. People have lived their whole lives with that, not realizing if they'd gotten rid of the Candida, it probably would have gone away as well. All right, I think that pretty much does it, except another very common thing, toenail fungus, athlete's foot. Those are all Candida and yeast as well. All right, so that takes care of the related symptoms and related conditions. Okay, so you go through with a list of things and you go, okay, well, it sure sounds like I have a lot of it. It sure sounds like I have Candida. But you know, we will get patients very often that just don't want to admit that they have Candida. They don't want to do what it takes to get rid of it. So they'll demand from us, well, we want some lab work done. All right, well, you can do that. There's a very free and expensive lab you can do, and you can do that at home. It's not 100%, and a lot of people poo-poo it, but it does seem to work pretty good. I've seen false negatives, but I've never really seen a false positive, and that's the old trick of spitting in a glass. I actually have seen that it works pretty good, but I've also seen cases where it wasn't so accurate. So I tend to tell patients you can try it if you want, but don't count on it necessarily, because I've seen patients who spit in the water, nothing happened, and they still had Candida. So what is the spit in the water? You can look it up on the web, but I can also tell you real quickly what it is. Basically what you do is you get a nice clear glass, has to be clear glass, you can look at it in the morning, fill it up and put it on your bedside table or your bedside table or somewhere nearby where you're going to remember it in the morning. You're going to look at it and remember it. It has to set out all night. Water has a specific gravity. That means some things float, some things sink. All right. When water sits out overnight, it literally degasses. So a little bit of the oxygen, chlorine, and such, depending on your city and where you're at, it will degas overnight, which will ever so slightly change the specific gravity. So now by morning, some things that used to float now might have a tendency to sink. So you leave a glass of water out all night, and you wake up tomorrow morning. Before you do anything with that mouth, before you eat, drink, before you brush your teeth, before you kiss anybody, you look over and you go, oh, my glass of water. Okay? Without picking up the water, without doing anything to it, because we don't want to disturb it, you get up, get close to the water, and basically your first saliva of the morning, spit in the glass, walk away for about 10 minutes. Don't bump it, don't move it, don't do anything with it for about 10 minutes. After 10 minutes, you come back, and again, don't pick up the water. Just kind of look at it from the side, hence the reason for being clear. Look at it, and if any of the water, any of the saliva has sunk, or very often is producing these little tails or trails coming down, that is usually a very good indication of Candida. Why? I suspect it's because of the surface tension of the water, specific gravity. Fungus tends to group together in water. That makes it heavier, and it floats down to the bottom and starts pulling down towards the bottom. But if you look at it and there's absolutely no tails, no dropping after 10 minutes, it's completely floating on top, it can be an indication that you don't have Candida, but again, I've seen many cases where that was still a false negative. So I tend to go, well, we can try it if you want, but I'm not really that positive about it. Other tests that you can do that are much more reliable, comprehensive stool test you can do. We do those for patients. You can do them. That will show the yeast were actually in the stool sample. Okay, it is very definitive. Another one that's very good is another kind of saliva test, only in this case, we actually grow a culture from it. It takes up to about 2 days. You basically give a saliva sample, put it in a petri dish, put it in the incubator, and we let it go for a couple of days. It's pretty good. It's pretty good and pretty indicative. You will see the Candida growing in there. So that's usually a pretty good test. One of the most definitive tests is a blood test. Blood test for basically the serum, IgA and IgMs. Those are usually really good antibodies to check for it, and that will tell us a lot whether you have it or not. That's a very, very good test. So we do any of those tests at the clinic, but these are tests that if not us, you can ask your other doctor to have those tests done and see if you've got it or not. You know, very often we tell patients, we hope you fail the test. We hope you have it, okay? Because it's easy to treat. It's very easy to treat. What's frustrating is when you don't know what's wrong with the patient and you have to keep continuing digging more and more to find it out. So it's always nice to find the answer. I've had so many cases. I've been practicing medicine, well, close going on 20 years. And I've had so many patients that come into the clinic and they're crying because we're their last ditch effort, last recourse. They're crying because they've been to so many other healthcare providers and they can't find an answer to what they're looking for. And then we're blessed. We're able to find an answer, and they start crying again. But now at least it's for joy, because at least they know what's wrong and it can be treated. And that's incredibly important to do for your patients. All right, so those are some of the tests you do. Well, what happens if you have Candida? One way or another, you've proven it, you know you got it, what are we going to do? Well, I've heard a lot of Candida programs out there. I've had a lot of patients come to the center saying, I had Candida, I don't have it anymore, because I went through and I did a Candida cleanse. Most of the time these cleanses they take some store-bought product for about a week or so. They eat a bunch of garlic and they think they're good. They think they're through it. Okay, I just have rarely ever find that works. A Candida cleanse is not a fun thing. It is not easy for most people to go through. And what do they say? Most things worthwhile are probably not going to be easy. And there's an old cliche, it was from Dr. Christopher, where he used to get asked by patients, how long will it take to get over so-and-so condition, whatever that is? Okay, Dr. Christopher always had the same answer. It took you years to get here, it's going to take you time to get through it. All right, so I heard another naturopathic doctor put it very succinctly once. He said, when it comes to chronic conditions, for every year you've had this condition, plan on a good month of hard work. A month of hard work. So, very common that someone can have a candida condition or a chronic condition for 12 years, where you're looking at a year of hard work. The good news is getting rid of candida, which can be one of the base or root causes from so many illnesses, really takes about 18 hard days and then about 2 months thereafter to regrow your garden. So I'm going to talk to you about our program, what we do. It's up to you what you do. But this program, I did not create this program. This program has probably been around for about 70 years. We learned it from Dr. Christopher, and we now pass it on to our patients, and we found it to be extremely, extremely successful. We have put thousands of patients over a couple of decades through this, and we've seen amazing results, and we'll talk about that here in a little bit as well. All right, so basically our program, how to get rid of candida effectively, and this is at least from my experience. It's an 18 good hard days of getting rid of it. You will almost guaranteed go through a detox. It's 18 days. It's broken down into 4 steps. Okay, and I will include information on this so that you can learn more about it if you would like to. Whether you come to our center or not, we will be more than happy to help you learn about it. All right, so it's 18 days. It's broken into 4 steps, basically stages 1, 2, 3, and 4. All right, remember how I called this your garden? Well, the way we look at it is steps 1 through 3. That is the 18 days. That is 18 days of tilling the soil, getting rid of all that was in there. And then step 4, which is for 2 months, that's now growing season. That's when we start doing probiotics and fermented foods. A lot of people think that once you start getting candida, or if you already have it, the big way to get rid of it is take a probiotic. That is just not the case. Taking a probiotic during a candida overgrowth, I like to call it respectfully, I like to call it the Jesus syndrome. There's no room at the end. There's nowhere. You take a probiotic, if you already have a candida overgrowth, it's too late. There is no real estate for the bacteria to colonize. You're just making expensive poop. That's all you're doing. You're taking it and it's going right back out again. Probiotics are great. We have in the dispensary in our center, but they're great for their time when they're more effective. And that is for us, that's in step 4, after the 18 days. It's basically 18 days of getting rid of the candida, getting the bowels ready, basically a clean slate, so that then we can then, after 18 days, and then comes the step 4, that's when we start rebuilding the garden, taking the probiotics and fermented foods. So what happens during the 18 days? Well, step 1 is for 2 days. Okay, step 1 is for 2 days, and it uses a very strong holistic medication that has black walnut and pau d'arco in it. You might as well call those the 2 atom bombs for candida, because they will wipe it out. So it's 2 days of very, very high doses of those, along with another formula that helps keep the bowels moving naturally, healthily, not a laxative. It keeps them going, because as the candida dies, you want to poop it out. You want to get it out of your system. Now, when you kill candida off at that level, you're going to get what's called a Herxheimer response most of the time. And that, short, is Herx response. That is a toxin detox going on. When candida is a yeast. When it dies, it produces something called a mycotoxin. Those mycotoxins normally there's just a few, 100 here or there die. It's not enough toxins to really bother you. But when candida bites to the thousands and thousands, when it dies by that much, that's a lot of mycotoxins, a lot going through your blood. You're going to most likely feel pretty bad. What are the symptoms that you have when you're going through a detox? Because a lot of people get scared. They think that they're dying, or they think that they're ill from something else. They will actually stop the cleanse. That's why we always have a candida consult at the center before they even are allowed to take the holistic medications home, because we go through it page by page, telling them this is what you can expect. All right, so don't be scared. All right, more gassy bloatiness, headaches, fatigue, almost flu-like symptoms, aches and pains. A lot of people will often experience depression or anxiety while they're going through it. We tell them this is all okay. Some people breeze through the Candida program, no problems. Most people do feel an effect from it, and so we try to forewarn them, and we try to tell them when you're going through a Candida detox. There are two great little tricks you can do that can help you get through it. And the number one, which is really good for most people, is drink a lot of water. Drink water. Take your body weight, divide it by 2. That's the number of ounces minimum you should be drinking every day. The more water you drink, the faster you flush your blood, the faster you flush the mycotoxins out before they really have an opportunity to make you feel like crap. And they do help quite a bit. Drinking does help quite a bit. The second method is not officially part of the program, though we do have a significant number of patients who do it, and we find that those that do it have received great benefit, and that is an old-fashioned colonic. I don't mean an enema, I mean a colonic, where you have to go to a licensed hydrotherapist. When that Candida is dying in those first 2 days in such massive amounts, sometimes it's a lot for the body to get it out. So we usually recommend to patients who think they're going to have a hard time, and a lot do, who think they're going to have a hard time, get a colonic scheduled on day 3, which is the start of step 2, which is past. You get past day 1 and 2, you're already through the worst of it. But get your colonic done on day 3 for those that want to do it. Not, you don't have to, but those that do. They find literally by the time they walk out of the hydrotherapist, they already are feeling so much better. It makes such a big difference. But again, it's a choice of the patient. So they get through step 1, which is about 2 days, and they get into step 2. Step 2 is for 14 days long. That's when we introduce another holistic medication that uses slippery elm and a lot of other things, and is literally meant to start soothing and healing the intestinal tract of those little leaky gut areas, the inflammation, the gaps. So it's 14 days of soothing, and patients usually notice quite a large difference or benefit during that time. Then you get to step 3. Step 3 is for 2 days. You're now on day 17 and 18. You're almost done. Okay, that is an exact duplicate of step 1. You're redoing step 1. The same hard thing you just did, you're redoing a step 3, but the big difference is I've never, ever had a patient go through step 3 and had as much problem as they did in step 1. Step 3 is just making sure whatever excess we didn't get, let's go after it one more time. And patients feel it. They can still feel the detox, but never as bad as they did with step 1. All right, so they get through that, and then yay, you finish with the worst part of it, which is the holistic medications. And then you get to step 4, which you now do for the next 2 months of significant doses of probiotics and fermented foods like sauerkraut, miso soup, Rejuvelac, apple cider vinegar, kimchi, plant-based yogurts. The list goes on and on. Remember how I said there are 1,400 different strains. There is no one food, there is no one product that has 1,400 strains in it. And be careful when you get probiotics. This is one of the biggest tricks that's used in the probiotic industry. You look on the bottle and you look on the label and it says 50 billion. Of course, they're bacteria. I could put thousands or a million on the head of the pen. All right, they're small, they're bacteria. Okay, one capsule is going to have billions of them in there. So don't go by the number of bacteria. Go by the number of strains. Most of these like to sell probiotics that have about 2 or 3 strains in them. All right, get a minimum of 15 or so strains. The more strains, the better. Remember, 1,400 we got to get up to. So the more strains, the better. And then there's also sauerkraut, kimchi, miso soup, apple cider vinegar, Rejuvelac. The list goes on and on. During those 2 months that you're now regrowing your garden, you want a diverse garden. You don't want a monocrop. You want a multitude of different crops. So you want to make sure you do as many different things as you can during that time to get it grown up. Now, one thing I didn't mention, and this is often considered the worst part of the cleanse, actually not the detox is, because people go into it psychologically thinking this is the worst part, and that's the diet. Okay, and this is where a lot of people fail on Candida diets in the past. They think, well, if I just take some antifungals, I'll be fine. Okay, it's not the case. We do a 2-prong approach. We have the antifungals that we take and things of that nature and the holistic medications. But while those are doing their job, we're also starving it out. And how do you starve it out? By not having foods with sugar and alcohol in it. So during those 18 days, steps 1 through 3 that we're doing this, we're also on a very special diet, and it is a vegan diet, which makes it much less inflammatory than most other diets, which we have a lot of inflammation with Candida, so we want to keep that down. It's also a sugar and alcohol-free diet. Now, we include a full menu plan for our patients. It's completely vegan, but they get to do things like veggie burgers. We're talking like the new Beyond Burgers and Boca Burgers and Amy's and those kind of things. You can have brown rice and quinoa and salads and the snacks. There's so many different snacks you can eat. And yet, even though there is so much food available, it is rare that we find a patient who gets through the Candida program who didn't lose weight. That's another benefit of Candida Cleanse. You do it right, you will lose weight. We've had patients lose anywhere from 20 to 30 pounds just during the time of their Candida Cleanse. And if they behave and they continue to do right after the cleanse, they keep the weight off. And we've seen that happen time and time again. All right. But the average weight loss is probably 10, 15 pounds. We see a lot come off of this, and that's a very healthy weight loss. All right, as long as they maintain good health afterwards, good habits and so forth. All right, so it is a sugar and alcohol-free diet. It is a vegan diet, and most people get into that from the psychological point of view. Oh, I can't do this. It's not going to work. And yet they find by the time the 18 days are over with, not only are their sugar cravings diminished vastly, their alcohol cravings diminished vastly, they also notice that their taste buds begin to change. And foods that they would have sworn they never would have been able to eat now taste pretty darn good. And we see that happen quite a bit with them as well. All right, so you do the holistic medications, you do a diet change, and then when the Candida 18 days is over with and you move on to step 4 of the Candida Cleanse, we still recommend that you try to keep the diet really clean for at least a couple of weeks, because if you go back to eating sugar and alcohol too quickly, it will regrow. I had a rather wealthy couple. They were new patients, came to the clinic, and they had decided, and they were quite right, they were quite ridden with Candida. One of their passions or hobbies is they love to go travel to seminars and conventions around the United States. That's fine. Nothing wrong with that necessarily. They came in and begrudgingly they did the Candida Cleanse and they made it through it. All right, and big changes for them. Unfortunately, they didn't do as we had asked. So if the Candida Cleanse medication part ends on day 18, that means from 19 on for the next 2 months, you're taking all the probiotics and everything else, and for about the first 2 weeks of step 4, try to stay pretty clean from sugar. You want to stay away from it. Give the bacteria time to regrow, otherwise you're going to let the Candida come right back. Well, on day 23, we got a call at the clinic. And the wife called, and she was just hysterical. She was crying and crying, and the staff put me on the phone. And I went, what happened? What's going on? And she kept crying for about another 15 seconds or so, and all she kept saying in between sobs was, I'm sorry, we're coming home. And I went, okay, what did you do? She said, well, on day 20, we left for a convention. I said, okay, great. You made it through the Candida Cleanse. Now you're supposed to do certain other things. I said, what happened? She said, well, on day 20, we left at the convention, and it was a candy convention. So they went straight from getting rid of the Candida, didn't give their microflora any period of time to regrow, and they started a Candida convention, and they were in pain. They were gassing, bloating, and they were just in a lot of gastrointestinal pain. They flew right home, did the Candida Cleanse one more time, and that was it. They were done. Okay. So what are some special case histories I've seen with getting rid of Candida? Because people go, well, what does it really do? Okay, well, with Candida, we have seen very minor issues. We've seen people with chronic sinus infections go away. People with chronic pulmonary lung issues go away or become vastly diminished. Let's see, we've also seen patients with chronic UTIs, and as I mentioned earlier, interstitial cystitis, go away. They don't have them anymore. I had a very, very special case, and I know this one sounds strange, okay, but this was an actual case. It was an autoimmune disease. In all my years of practice, I've only seen 2 cases of it, polygynia rheumatica. It's an autoimmune disease in the same neuromuscular family as MS, muscular dystrophy. Basically, in this case, it's autoimmune, very Jerry Lewis telethon type of thing, saying it's incurable. They have no cure for it. All they can do is put you on Imuran and prednisone and other immunosuppressants. The list goes on and on. All right, or remove your thymus gland. Okay, so I've had 2 cases ever in all my career. In both cases, went away. Lab reports showed it, other doctors could see it, they were cured. But it was the second that was most important. This is back in April of 2014. A young lady came into the clinic, she'd been diagnosed, I looked at her blood work and they were correct, she definitely had it, it was an autoimmune polygenic. What is that anyway? What is the rheumatica, polygenic rheumatica? Well, in that case, you're basically attacking your own muscles. Most people with this condition become quite obese because just every little movement, everything they do hurts so bad they don't want to move, so all they do is kind of sit and eat. It's a very comfort thing, I get that. All right, so she came in, we had her initial appointment, we went through everything, and before the appointment was over with, she got ready to get up. You know, we'd already agreed. I said, okay, I agree with the diagnosis, we'll go ahead and get your program together and we'll get started in a couple of days. She got ready to get up out of her chair and she went, oh, doctor, by the way, I forgot to tell you, I have a really, really, really bad case of Candida. And I went, oh, okay, how do you know? This is before I made it a regular thing to always treat for it. And there was no need to test her. She definitely had it. She had no problem admitting to it. I said, well, here's our general protocol. Most patients come into the clinic and they have multiple issues. Okay, that's just pretty much the way it is with chronic. We say as long as those multiple issues are not emergency or seriously acute, we say put them aside for now. Spend the 18 days and get rid of the Candida. Because remember, this right here, remember I told you all about the 1,400 different types of microflora? This is 70% of your immune system. 70% of your immune system, what keeps you from having colds, flus, cancers, starts here. Fix this first, then go on and treat the other issues. And very, very often we find out that even if the issues didn't disappear after the Candida cleanse, they usually do heal much faster, a lot less expensive if you get rid of the Candida first. Get your house in order, then you can treat the other issues. Well, she agreed. She went off and did the Candida cleanse, and I didn't hear from her for 18 days because very often, and I get it, we allow our email to go out so patients can get a hold of me 7 days a week, and because it can be very trying, very scaring sometimes going through Candida cleanse. So, and we often hear from them, but didn't hear from her at all for 18 days, which is wonderful. Okay. With Candida cleanses, we always have patients come in right after the 18 days so that we can reassess where they're at. How'd you do? How'd things go? All right, now let's go treat whatever's left over. Okay, well, she came in, and I was talking to her, and I said, wow, I didn't hear from you, so I assume everything's fine. She said, yeah. She said, everything's great. And oh, by the way, she said 2 weeks into the Candida cleanse, remember 18 days, so it's only about 2 weeks, 4 days. She said 2 weeks into the Candida cleanse, all my pain went away. I went, oh, because I'd never heard of that before. She said, all my pain went away. I said, well, I don't want this to be some kind of remission. I said, because you are slowly going to be going back on, getting off of the Candida diet. So I said, let's do this. Let's just go ahead and treat you with our normal polygenic rheumatica autoimmune program. Because normally it's 9 months to a year for things like that, for MS, muscular dystrophy, cancer, Lyme disease. It usually takes 9 months to a year. I said, well, I'll tell you what. Let's just do it for 1 month. Let's do the autoimmune protocol for 1 month. And then I'll see you in a month and we'll reevaluate you and see where you're at. I mean, you're already pain-free, but I don't want you to really just be in some kind of remission and then it comes right back. So she agreed. We dispensed the holistic medications for that condition. Didn't hear from her a month. She came back and at her month appointment. I said, well, again, this sounds all good. Everything's going fine. This is exactly how the rest of the conversation went. I said, well, how are you doing? And she literally went, I feel great. That was it. She never did get it again. She never did have another problem with it. It went away and she was good after that. So what is supposed to be a Jerry Lewis telethon type of incurable type disease, nothing against Jerry Lewis telethon. I'm saying that's the kind of the issues they deal with. It was gone. She never did have it again. So I'm not saying that Candida will cure all your issues. At the very least, I've seen it make it easier to get over them, but I have seen cases to where it just goes away and it doesn't come back as long as the patient behaves and eats properly after that, does not go back to SAD, the standard American diet. Obviously, simple cases like the rashes go away, or toe fungus, or athlete's foot. One more case study for you real quick, and then maybe we can talk about these another time, is there was one patient, this was quite some years ago, he was diagnosed with a very serious rash condition, and they had no idea what it was. He was covered from literally the top of his head down to his feet with this rash that was insanely itching, and it was incredibly debilitating. He'd had it for 9 months. By the time we saw him, he had been sitting in a chair for 3 months. Basically, that's all he could do was just sit and not do too much, go to bed and stuff like that. But he couldn't move around much during the day because any movement set it raging and basically brought it back alive again. It was horrendous. He looked incredibly sad. Well, we have patients all over the world, and this one was in Arizona, so we basically did it all over Facebook. I mean, over FaceTime, which, you know, I'm glad we were able to do. I generally don't like that, but it can be very successful. And one of the jobs of a naturopath is to get, it's actually part of the medical code of ethics, is we're supposed to get to the root cause. What's going on? Just don't treat you with a Band-Aid, but figure out what the problem is. Well, we said, okay, talk to me about what happened 9 months ago. What happened to have brought this condition about? Well, we narrowed it down really fast. He said just before it all started, and I'm kind of surprised none of the other doctors ever asked these questions. They were doing biopsies and punch biopsies, and nobody could ever come up with it. What had happened was that, which is a good thing, he decided he wanted the mercury amalgams removed out of his mouth. Unfortunately, like so many people, they don't go to a dentist that's properly trained. Most dentists will say they know how to remove them. They don't. You have to be very specific with your dentist and make sure that you find one that is truly qualified in removing them. They use the dams, they use the suction. It is a very special protocol to removing them, because once you drill in, the mercury vapor comes out, you breathe it in, it gets into your mucous membranes. Getting heavy metal toxicity, for example, from mercury, it's just like taking a super antibiotic. It wipes all your microflora out, and bingo, there goes the Candida. Well, he said he had gone to that, and he remembered now, about a couple of days or so after he had the amalgams removed, he started getting these little rashes started appearing, which then progressed over the period of a few days and weeks to where it literally covered the rest of his body. And I said, well, what you have is Candida vasculitis. All right. So I said, the first thing we need to do is to go on a Candida cleanse. So we did. This rash used to cover him from the top of his head, the bottom of his feet, basically. Within 18 days, had gone from this huge rash to one little piece left on his arm. After that, we put him on a very short heavy metal detox, chelating the mercury and all the other stuff out, and it all went away. Within 18 days, he had almost complete recovery, and then the rest of it disappeared. But literally within the first week or two of the cleanse, the itching had already stopped, and it was vastly shrinking by then. Something as simple as that is all it takes. All right. Obviously, other things that we've seen go away. Type 2 diabetes, you lose the weight, other things like that. We've seen those happen, so weight loss. Pain reduction, we've seen pain reduction within 4 days of starting the Candida cleanse. The pain goes way down. Sometimes it disappears completely, but sometimes it just goes down quite a bit. Okay, alrighty, so that's the dreaded disorder of Candida, one of the most common conditions in America. Probably one of the most common basic causes or root causes of most conditions that I've seen. And even if it didn't cause it, it was absolutely an aggravating factor to it. Get rid of the Candida, the rest of it can go a lot faster, can heal a lot better. All right, so if you're interested in more information about this, please feel free to contact our center. We'll put something at the end of the video for you, so you can contact us if you like, or go to a holistic practitioner or another doctor who is more open-minded and skilled in alternative treatments and protocols, or has taken the time to learn about Candida. You might be surprised if you do it right. If you get rid of the Candida right the first time, then you only have to do this once in your life. and then change your diet. Get better, you won't have to deal with it. Remember, don't ever become a part of a doctor's retirement program. Get better, go away, spend your money somewhere else, all right? Well, it was a pleasure talking to you all. This is Healing Through Nature, and next episode is going to be on, again, one of the most common conditions. We'll try to do this one the next week or two, and that is parasites, intestinal parasites. CDC said that they estimate about 1 out of 6 Americans have intestinal parasites. We see it extensively at the center. I think it's probably more than that. All right, so we look forward to talking to you again soon. All of you have a most blessed rest of the day. Bye-bye.
Let me bring you songs from the woods to make you feel much better than you could know.